A series of articles and books have popped up lately denying that ADHD is a legitimate disease. Some have cited allegations that Dr. Leon Eisenberg, an early pioneer in identifying ADHD, made a deathbed confession that ADHD is a fictitious disease. So, is ADHD a legitimate disease? The first question that needs to be answered is, what's a disease? Diseases are social constructs. Our concept of disease is linked to our understanding of what constitutes normal human health. Diseases are deviations from the norm that are believed to be damaging to the individual, and in some cases, society. Genius, for example, is a deviation from the norm, but it's viewed as an asset, not a liability. It is not a disease. We wouldn't think to treat a high IQ. Diabetes, on the other hand, is considered a disease because it's a deviation from the norm, and it's viewed as harmful to the individual. Slapping on the disease label gives permission to the medical establishment to develop treatments that alleviate these symptoms and presumably improve the length and quality of life of those who have been diagnosed. If the vast majority of people had diabetes, it would be considered normal human health, and the lucky few who are able to produce insulin more efficiently would be considered exceptional, like geniuses. Likewise, the condition we call schizophrenia is a deviation from the norm, and most of those who show symptoms, delusions, and hallucinations are viewed as a threat to themselves and society. Giving medication for schizophrenia narrows the gap between schizophrenic behaviors and the norm, and allows a person to live a more productive life. It gets murkier with ADHD, which qualifies as a deviation from the norm. Most people don't have ADHD behaviors, or it would be considered normal to leave your suitcase on the train or zone out when someone is talking to you. But unlike diabetes and schizophrenia, there's some question about whether the treatments help the person with ADHD live a healthy and productive life in the long term. Indeed, the traits associated with ADHD often come packaged with high-value strengths. Being preoccupied with the perceived weaknesses of ADHD may hurt the individual's self-esteem and, potentially, his contribution to society. What's more, labeling ADHD as a disease puts teachers, guidance counselors, doctors, and parents on autopilot. They believe that anyone who exhibits the symptoms has the disease and should receive treatment, notwithstanding the potential downside. Child can't pay attention in class, acts out. Get him on meds. Because of the disease label, we become locked in and willing to overlook the medication's negative side effects. Dr. Leon Eisenberg, the father of ADHD, said just before his death that ADHD is a prime example of a fictitious disease. Early in his medical career, in the mid-1950s, Leon Eisenberg became fascinated with the childhood mind. Wanting to know more, he broke free from the shackles of the Freudian psychoanalytic dogma that dominated child psychiatry at the time to conduct groundbreaking biologically based research of childhood developmental problems. This research included the first randomized clinical drug trials in child psychiatry. I think what Leon brought to the field was a different way of thinking out of the box, said David DeMasso, chairman of psychiatry at Boston Children's Hospital and professor of psychiatry and pediatrics at Harvard Medical School. He was thinking in terms of biology, of evidence-based treatment, way before anybody else. His was a biopsychosocial model at a time when psychoanalytical thinking was the norm. Eisenberg's direct involvement as a child psychiatry researcher was over by 1967, when he moved to Harvard Medical School as chief of psychiatry at Massachusetts General Hospital. But in a dozen years, he had helped transform the discipline. I've been seeing this story making the rounds about how the alleged inventor of ADHD, a Dr. Eisenberg, had a sort of deathbed confession, and in an interview with Der Spiegel, 7 months before he died at 87, said, ADHD is a prime example of a fictitious disease. Leon Eisenberg, the father of ADHD, is quoted as saying in Der Spiegel that ADHD is a fictitious disease. Shortly before his death, 1 out of every 10 10-year-old boys already takes an ADHD drug daily. But the scientific father of ADHD has followed the explosion of prescriptions with growing horror. Leon Eisenberg took over the management of psychiatry at the prestigious Massachusetts General Hospital in Boston and became one of the most famous psychiatrists in the world. In his last interview, 7 months before his death from prostate cancer at the age of 87, he distanced himself from his youthful indiscretion. A tall, thin man with glasses and suspenders opened the door to his apartment in Harvard Square in 2009, invited me to the kitchen table, and poured coffee. He said that he never would have thought his discovery would someday become so popular. ADHD is a prime example of a fabricated disorder, Eisenberg said. The genetic predisposition to ADHD is completely overrated. Instead, child psychiatrists should more thoroughly determine the psychosocial reasons that can lead to behavioral problems, Eisenberg said. Are there fights with parents? Are there problems in the family? Such questions are important, but they take a lot of time, Eisenberg said, adding with a sigh, prescribe a pill for it very quickly. Spiegel. In the 1960s, mental disorders were virtually unknown among children. Today, official sources claim that 1 child in 8 in the United States is mentally ill. On a related note, an August 2012 Der Spiegel English language interview with now retired Harvard psychologist Dr. Jerome Kagan quoted Dr. Kagan as being critical of fuzzy diagnostic practices and the overprescription of drugs such as Ritalin for behavioral problems in children, and as referring to ADHD as an invention. Kagan. That's true, but it is primarily due to fuzzy diagnostic practices. Let's go back 50 years. We have a 7-year-old child who is bored in school and disrupts classes. Back then, he was called lazy. Today, he is said to suffer from ADHD, attention deficit hyperactivity disorder. That's why the numbers have soared. Spiegel. Experts speak of 5.4 million American children who display the symptoms typical of ADHD. Are you saying that this mental disorder is just an invention? Kagan. That's correct. It is an invention. Every child who's not doing well in school is sent to see a pediatrician, and the pediatrician says, it's ADHD. Here's Ritalin. In fact, 90% of these 5.4 million kids don't have an abnormal dopamine metabolism. The problem is, if a drug is available to doctors, they'll make the corresponding diagnosis.
Robert Berezin has practiced the long-term intensive psychotherapy of character for 45 years. He taught at the Department of Psychiatry at the Cambridge Hospital, Harvard Medical School for 30 years. He is the author of Is Psychotherapy of Character? The Play of Consciousness in the Theater of the Brain. He has done extensive blogging on his website, Psychology Today, and Mad in America, on a wide array of topics. E.M. How would you suggest a parent think about being told that his or her child meets the criteria for a mental disorder or a mental illness diagnosis? R.B. In my opinion, raising our children well is the most important responsibility of adult life. Consequently, helping children is a very timely subject. The range of problems for children are quite finite. Acting out behaviorally, impulsivity, problems of concentration and learning. Children can be phobic or anxious. Children can be sad, apathetic, depressed. Children can develop obsessional or compulsive symptoms, even psychotic symptoms. This is a terrible time for parents whose children are referred to the mental health system. The last thing in the world that any child needs is to be given a mental illness diagnosis or to be told they have a mental disorder. Children may certainly have problems, but they should not be thought of in terms of mental illness. They are just kids. In today's world of psychiatry, children will almost definitely become labeled. If you are going to work with a professional, with whatever degree, it's important for them to be clear that despite some insurance diagnosis, they understand that a child's issues are not biological. Remember, never use a label with a child, or an adult for that matter. Most issues derive from family problems and school issues. Children with different temperaments will react with different kinds of symptoms. Do not ever accept a diagnosis of childhood manic depression. Autism is a complicated issue. There are no doubt environmental issues that have altered the frequency of the diagnosis. Classical autism is very different from today's autism. It is a serious neurological issue, not psychiatric. Autism is also overdiagnosed today, so be careful about that. How would you suggest a parent think about being told that his or her child ought to go on one or more than one psychiatric medication for his or her diagnosed mental disorder or mental illness? Honestly? Suggest to the parent that they find another therapist. In my opinion, there are no conditions that would warrant psychiatric drugs. Antidepressants do nothing and can generate suicidal behavior among children of all ages. ADHD as a so-called disease is fictitious. Yes, kids get out of control behaviorally and impulsively, along with having concentration issues. This comes from a child with an active temperament who needs clear boundaries and physical activity. When they are too out of control, there needs to be family therapy and behavioral therapy, and the school needs to be adaptive. There is often trauma present with severely out-of-control children. Amphetamines are dangerous drugs. I disagree with their use. Likewise, with other issues, there should be family work. Other drugs, like benzodiazepines, are also very destructive. With a good therapy, things can work out very well. What if a parent currently has a child in treatment for a mental disorder? How should he or she monitor the treatment regimen and/or communicate with mental health professionals involved? RRB. By and large, parents should always be involved in the treatment. Most issues with kids are family issues in the first place. With separate treatments, the parents need to meet periodically to make sure they are in sync with what is going on. Do not surrender to the system your own parental authority. They must work with the parents. What if a parent has a child who is taking psychiatric drugs, and the child appears to be having adverse effects to those drugs, or whose situation appears to worsening? What would you suggest the parent do? I am totally opposed to psychiatric drugs for children. Parents need to get a second opinion with a different kind of psychiatrist who understands that the problems of children are not biochemical. The child needs to taper off his meds carefully. If a parent has a child on drugs and the situation is worsening, this is an emergency, and there should be no hesitation. A child's life may be at stake. There is a black box warning on antidepressants for a reason. This is a critical look at the current mental disorders of childhood, and is one opinion of many. We would like to hear your thoughts on the subject. Thank you for watching, and see you in the next video.